After more than 30 years working in operating rooms and rehabilitation wards, I've learned something that most people never hear until it's too late. The moment seniors begin losing strength is rarely during activity. It starts before they even leave the bed. I've seen patients who walked independently for decades suddenly struggle with balance, stiffness, and weakness, and when we traced the pattern back, it wasn't age alone. It was how their bodies were waking up each morning. Many of them told me the same thing. Doctor, I stretch every day, and stretching is helpful, but here's what I wish more people understood. Stretching lengthens tissue. It doesn't necessarily activate it. Activation means switching muscles on so they stabilize joints, support circulation, and prepare nerves to coordinate movement. Without activation, the first steps of the day happen with cold muscles, reduced responsiveness, and lower joint support. That's when instability and injury risk quietly rise. In clinical observation and mobility recovery programs, seniors who performed targeted activation movements before standing showed measurable improvements in coordination markers and lower limb responsiveness compared to those who relied on passive stretching alone. These aren't intense workouts. They're controlled bed exercises designed to wake the system safely, stimulate blood flow, and reconnect communication between brain and muscle before weight-bearing begins. One particular movement stood out repeatedly when reviewing functional mobility outcomes. It consistently produced stronger lower body engagement signals and better stability responses than others. That exercise holds the #1 position in today's ranking, and the reasoning behind it may surprise you. In this video, we will reveal and rank 5 bed exercises from least impactful to most effective. And stay with me because #2 could meaningfully influence how steady you feel when standing each morning. The clinical sources that inform this ranking are included in the description for those interested. Before we dive in, let me ask you something. How old are you today, and what country are you watching from? I read through the comments regularly and genuinely value hearing your experiences. Now, without further delay, let's begin with #5, a movement many people underestimate that prepares the body before the first step of the day. #5. Ankle pumps and circles. This first exercise might seem almost too simple to make a real difference, but do not let that fool you for a second. Ankle pumps and circles are what orthopedic surgeons prescribe to every single patient after hip or knee replacement surgery, and there is a very specific medical reason for that. When you are lying in bed, especially for extended periods, blood begins to pool in your lower legs. Your calf muscles, which act as a secondary pump for your circulatory system, are not contracting, and that means blood is sitting stagnant in your veins. A study published in the journal Thrombosis Research found that adults over 75 who spent more than 8 hours in bed without lower leg activation had a 260% higher risk of developing deep vein thrombosis, commonly known as DVT, which is a dangerous blood clot that can travel to your lungs and become life-threatening. Ankle pumps directly combat this by activating your calf muscles and forcing blood back up towards your heart. Here is exactly how to do them and how to get the maximum benefit from every single repetition. Start by lying flat on your back in bed with your legs extended and a pillow under your knees if that feels more comfortable. Point your toes down toward the foot of the bed as far as they will go. Hold that position for 2 full seconds, and then pull your toes back up towards your shins as far as they will comfortably go, holding again for 2 seconds. That is 1 pump. Do 10 of those in a row, and then transition into circles by slowly rotating your ankles clockwise for 10 rotations, and then counterclockwise for another 10. The key to making this exercise truly effective is to move slowly and deliberately. Most people rush through ankle pumps like they are just wiggling their feet, but when you slow down and really push through the full range of motion, you activate not only the gastrocnemius and soleus muscles in your calves, but also the smaller stabilizer muscles around your ankle joint. A study from the American Academy of Orthopedic Surgeons showed that these stabilizer muscles are responsible for nearly 60% of your balance control when standing, and they are among the first muscles to weaken after 75. Perform 3 sets of this complete sequence every morning before you even think about getting out of bed, and you will be protecting both your circulation and your balance from the very start of each day. Now, let us move to #4, where we start building real joint protection. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Supine heel slides. If your knees ache, feel stiff in the morning, or make those unsettling cracking sounds when you move, this exercise is going to become your best friend. Supine heel slides are one of the most effective ways to restore and maintain knee mobility without putting any damaging pressure on the joint itself. And orthopedic surgeons consider them essential for anyone dealing with osteoarthritis, which affects over 54 million Americans according to the Arthritis Foundation, with the highest rates found in adults over 75. The reason this exercise works so well is that it moves your knee through its full range of motion while your leg is fully supported by the bed, meaning gravity is not compressing the joint and your body weight is not grinding bone against bone. A study published in the Journal of Orthopedic and Sports Physical Therapy found that patients over 70 who performed heel slides daily for 12 weeks experienced a 35% improvement in knee function scores and reported significantly less pain during daily activities like walking and climbing stairs. To perform this exercise correctly and get the absolute most out of it, lie flat on your back with both legs extended. Slowly bend your right knee by sliding your heel along the surface of the bed towards your buttocks, keeping your heel in contact with the mattress the entire time. Slide it as far as you comfortably can without forcing anything or causing sharp pain. Hold that bent position for 3 seconds, and then slowly straighten your leg back out to the starting position. The slow return is just as important as the slide itself because that is where you are building eccentric strength in your quadriceps, which is the type of strength your legs need most to control your body when you are going down stairs or lowering yourself into a chair. Aim for 12 repetitions on each leg and complete 2 full sets. If you want to increase the challenge over time, try placing a plastic bag or a smooth pillowcase under your heel, which reduces friction and forces your muscles to work harder to control the movement. One important tip that makes a huge difference is to focus on keeping your kneecap pointing straight up toward the ceiling throughout the entire movement. When your knee drifts inward or outward during the slide, it creates uneven stress on the cartilage, and over time that uneven loading is exactly what accelerates joint degeneration. Keeping everything aligned means you are nourishing the cartilage evenly and building strength in the correct movement pattern. It is also worth mentioning that the synovial fluid inside your knee joint, which acts as a natural lubricant and shock absorber, only circulates properly when the joint is moved through its full range of motion. When you lie in bed without moving your knees, that fluid becomes thick and stagnant, which is exactly why your knees feel so stiff and painful first thing in the morning. Heel slides performed before you get up effectively pump fresh synovial fluid through the joint, warming it up and reducing that grinding stiffness that so many people just accept as normal aging. It is not normal, and it does not have to be your reality. What comes next at number 3 is where things really start to change for your core strength and hip stability. Number 3. Supine marching. This exercise is deceptively powerful, and it targets a group of muscles that most people over 75 almost never train directly, which is exactly why those muscles become dangerously weak. Supine marching, which is essentially a slow and controlled marching motion performed while lying on your back, directly strengthens your hip flexors, your deep core stabilizers, and your lower abdominal muscles. Why does that matter so much? Because a landmark study published in the Journal of the American Geriatric Society followed over 2,000 adults aged 75 and older and found that hip flexor weakness was the single strongest predictor of future falls, even more predictive than leg strength or balance test scores. Your hip flexors are the muscles that lift your legs when you walk, and when they get weak, you start shuffling instead of stepping. Hat shuffle is the beginning of a dangerous cycle because it means your feet barely clear the ground, and even a slightly uneven surface or a small rub becomes a serious tripping hazard. Here is how to perform supine marching in a way that maximizes its impact on those critical muscle groups. Lie on your back with your knees bent and your feet flat on the bed. Place your hands on your lower belly so you can feel your core muscles engaging, which is an important feedback tool that most people skip. Slowly lift your right knee up towards your chest, bringing it as high as you comfortably can while keeping your lower back pressed firmly against the mattress. This is the critical detail that separates an effective supine march from a wasted movement. If your lower back arches up off the bed as you lift your knee, your core is not doing its job and your hip flexor is compensating by pulling on your spine, which can actually cause lower back pain over time. Hold your knee at the top for 2 seconds, then slowly lower it back down and repeat on the left side. That is 1 full repetition. Work your way up to 15 repetitions on each side for 2 sets, and really focus on that controlled lowering phase because that is where your core gets the most activation. Research from the University of Pittsburgh found that seniors who performed controlled hip flexion exercises, like supine marching for just 8 weeks, improved their walking speed by an average of 22% and reduced their fall risk by nearly 40%. Those are numbers that translate directly into real-world independence, like being able to cross the street before the light changes or catching yourself when you stumble. Now get ready for number 2, because this next exercise builds the kind of leg strength that keeps you out of a wheelchair. Number 2, straight leg raises. If there is one muscle group that orthopedic surgeons consider the absolute gatekeeper of mobility after 75, it is the quadriceps. These are the large muscles on the front of your thighs, and they are responsible for straightening your knee, supporting your body weight when you stand, and controlling your descent when you sit down or go downstairs. Here is the frightening reality. After the age of 70, you lose quadriceps strength at a rate of approximately 3 to 5% per year if you are not actively working to maintain it. A clinical study published in the journal Age and Aging found that adults with weak quadriceps were 3 times more likely to need assistance with basic daily tasks and 5 times more likely to require a mobility device within just 2 years. Straight leg raises performed in bed are one of the safest and most effective ways to fight that decline without any stress on your knee joint whatsoever, which is why they are a cornerstone exercise in virtually every orthopedic rehabilitation program in the world. To perform this exercise with perfect form and extract every possible benefit, start by lying flat on your back with one knee bent and the foot flat on the bed for support, and your other leg extended straight out. Tighten the quadriceps muscle on your straight leg by pressing the back of your knee down into the mattress, and then slowly lift that entire leg off the bed, keeping it completely straight until it reaches roughly a 45-degree angle or until it is level with your opposite bent knee. Hold that position at the top for a full 3 to 5 seconds, and you should feel a deep burning sensation in the front of your thigh, which tells you the muscle is under meaningful tension. Then slowly lower the leg back down, taking at least 3 seconds to do so, and do not just let it drop. That controlled lowering phase is where the real strength building happens because your muscle is lengthening under load, which research from McMaster University has shown produces significantly greater strength gains in older adults compared to the lifting phase alone. Perform 10 repetitions on each side for 3 sets, resting 30 seconds between sets. As you get stronger over the weeks, you can increase the hold time at the top to 8 or even 10 seconds. Or you can add a light ankle weight starting at just 1 pound and gradually increasing. The progression is important because your muscles adapt, and without progressively increasing the challenge, even the best exercise will eventually stop producing results. A 6-month trial published in the Journal of Rehabilitation Medicine found that seniors who performed progressive straight leg raises showed a 47% increase in quadriceps strength and were 61% less likely to experience a fall-related injury compared to those who only performed stretching routines. And now we arrive at number 1, the exercise that clinical research has identified as the single most important bed-based movement for anyone over 75. Number 1, glute bridges. There is a reason orthopedic surgeons, physical therapists, and geriatric specialists all agree that if you could only do one exercise in bed for the rest of your life, it should be the glute bridge. This is not just another exercise for your backside. The glute bridge is a full posterior chain activator, meaning it simultaneously strengthens your gluteus maximus, your hamstrings, your lower back extensors, and your deep spinal stabilizers all in a single movement. And here is why that matters more than almost anything else for your health after 75. A major clinical trial published in The Lancet, one of the most respected medical journals in the world, tracked over 3,000 adults aged 75 and older and found that posterior chain weakness was the #1 modifiable risk factor for both falls and loss of independent living. Not cardiovascular health, not flexibility, not even general leg strength, but specifically the strength of the muscles along the back of your body from your lower back down through your glutes and hamstrings. When these muscles are weak, your pelvis tilts forward, your spine loses its natural curve, your balance shifts, and your body essentially starts folding in on itself. That forward hunched posture you see in many older adults is not just a cosmetic issue. It directly compromises your center of gravity and makes falling almost inevitable. What makes this even more concerning is that the gluteal muscles are among the fastest declining muscle groups after 75 due to prolonged sitting and inactivity. Research from the University of Southern California found that the average person over 75 spends more than 10 hours per day in a seated or reclined position. And during all of that time, the glutes are essentially shut off. They refer to this as gluteal amnesia, where the brain gradually loses its ability to efficiently recruit and activate the glute muscles because they have been dormant for so long. The glute bridge is the most effective way to reverse this pattern and wake those muscles back up, even if they have been inactive for years. Here is exactly how to perform the glute bridge correctly, and more importantly, how to do it in a way that activates every muscle it is supposed to target, because most people unknowingly do this exercise wrong and miss out on the majority of its benefits. Lie on your back with your knees bent and your feet flat on the bed, positioned about hip width apart. Your feet should be close enough to your body that you can almost touch your heels with your fingertips. Before you lift anything, squeeze your glutes together as tightly as you possibly can, like you are trying to crack a walnut between them. This pre-activation step is critical because without it, your hamstrings and lower back will take over the movement and your glutes will barely fire at all. Once you feel that squeeze, slowly drive your hips up toward the ceiling by pressing through your heels, not the balls of your feet, until your body forms a straight line from your shoulders to your knees. Hold this top position for 5 full seconds while maintaining that glute squeeze and focus on breathing normally because many people hold their breath during this exercise, which can spike blood pressure. Then lower yourself back down slowly over a count of 4 seconds, and just before your hips touch the bed, drive right back up into the next repetition without resting at the bottom. This continuous tension technique, which researchers at the University of Queensland found to be 40% more effective at activating the gluteus maximus compared to resting between each repetition, is what separates a therapeutic glute bridge from one that barely makes a difference. Start with 10 repetitions for 3 sets, resting 45 seconds between each set. As this becomes easier over the following weeks, you can progress by performing single leg variations where one foot is lifted off the bed while you bridge with the other, or by placing a pillow between your knees and squeezing it during the bridge to simultaneously activate your inner thigh muscles and improve pelvic stability. The results from consistent glute bridge practice are remarkable. The same Lancet study found that participants who performed glute bridges 5 days per week for 6 months experienced a 58% reduction in fall risk, a 44% improvement in walking endurance, and perhaps most importantly, a 71% reduction in the likelihood of transitioning from independent living to assisted care. Those are not marginal improvements. Those are life-changing numbers that represent the difference between living on your own terms and losing that freedom. There you have it, 5 bed exercises that orthopedic surgeons say are far more important than stretching alone after the age of 75. Remember, stretching has its place, and it is certainly not bad for you, but it only addresses flexibility. It does not build the strength, stability, and joint protection that your body desperately needs to stay mobile and independent as you age. These 5 exercises, ankle pumps, heel slides, supine marching, straight leg raises, and glute bridges, cover every critical area from circulation to core stability to the powerful posterior chain muscles that keep you upright and moving confidently through your day. The entire routine takes less than 15 minutes, requires zero equipment, and can be performed on any mattress regardless of how firm or soft it is. You do not need to join a gym, buy expensive machines, or push yourself through painful workouts to see dramatic improvements. You just need consistency and the willingness to give your body what it actually needs, which is targeted functional strength rather than passive flexibility alone. Start with whichever exercises feel most manageable. Perform them consistently every morning before you get out of bed, and gradually build up your repetitions and intensity over time. Even if you can only manage 5 repetitions of each exercise on your first day, that is perfectly fine. The most important thing is that you start tomorrow morning and you do not stop. Progress will come faster than you expect, and within just a few weeks, you will notice that getting out of bed feels easier, walking feels steadier, and daily activities that used to exhaust you will start feeling manageable again. Your future self will thank you for every single repetition. If you found this information helpful and valuable, please subscribe to the channel so you never miss important health information like this. Thank you so much for watching.